Peyronie's, and that is a penile curvature, correct?
That's correct.
How common is this?
So Peyronie's disease, which is essentially a curvature to the penis, secondary to some sort of scarring that they may have developed. It's fairly common. Now, depending on some of the studies, they'll report a prevalence of about 11 to 13%. Unfortunately, it's incredibly underreported. And let's face it, a man uses their penis throughout their life. And the penis is like a car. The newest you have is the day you're born. You're gonna have dings and dents. And the penis that you have when you're 50, 60, 70 is not the same penis you had when you were 18 years old. So if you look at the data, it's 11 or 13% prevalence, incredibly underdiagnosed, so maybe less than 1% of that.
So wait, you can develop a curvature over time?
Absolutely.
Oh, really? And what causes that?
Typically, it's secondary to trauma.
Okay.
So we're talking about, most guys do not come in and say, I had a major event, such as a penile fracture. Most guys will say, I don't remember injuring my penis. And so the concept is maybe microtrauma from usage over time. You develop these injuries to the surrounding structure, the part that surrounds the actual corpora cavernosum, which is the part that fills up with blood. Okay. And over time, they develop scar, and that'll cause some curvature of the penis.
Okay, let's look at symptoms of Peyronie's disease. We have a list here. So symptoms would be, go ahead and walk us through these, Dr. Martinez.
So here's some of the symptoms that you can have. Some scar tissue, a significant bend to the penis, erectile problems, shortening the penis, and pain. Typically, the two symptoms that patients will present with will be either something that feels like a scar and or a pearl or a little rock or a pebble within the penis, or they'll present with a penis that's curved up, left, right, down. Sometimes you can have a complex curve as well.
Okay, and can this go away on its own?
Yes, it can. So there are two phases. There's the active phase, which means that the bend is progressing, and then there's the stable phase. Right now, our understanding is 50-40-10. In other words, 10% of patients will get better, they do nothing. 40% stay the same. Unfortunately, 50% get worse. And so this is probably, again, another one of these things that men should seek help for, because there are plenty of things we can offer them for therapy.